Hi guys, this is Dr. Buleni, feminine and cosmetic dentist. Welcome to my channel. Thank you for tuning in. Today I'm talking about how dental caries develops. How do your teeth really get rotten? Well, the saliva, the bacteria, the biofilm that you have, when it gets combined with your sugar, your acidic drinks, or the refined carbohydrate that we eat, they just form that conglomerate of attackers, acid attackers that attacks your enamel, and then this is shown by your enamel becoming chalky white, and then mostly in the gingival area and the gum area. It's mostly in the gum area, in between the teeth, or on the molars, on the fissures where you eat. Okay, so that's why it's important to, when you brush your teeth, you brush in circles. Make sure that close to the gums you brush, in between you floss, and also closely where you chew, you also brush there as well, because of when the food stick in between the fissures, then it makes it easier for you to have dental caries or your teeth to be rotten. It's that simple. The pH drops. With the food that you eat, the refined carbohydrates and the sugars and the acidic drinks that we take, even orange juice, because it has a lot of acid, it drops the pH. The mouth is supposed to be at the pH of 5, which is 5 to 5.5, which is a normal pH, and then immediately it drops due to the bacteria, the refined carbohydrates, the sugar, or the acidic drinks that we drink. Then it starts to be, your enamel starts to demineralize. That does not happen though immediately. It happens after 20 minutes of eating. Let's say you're eating and then 20 minutes time, you're still eating or still having that fizzy drink or having the chocolate. Then that's when the demineralization, where the acid attack happens on the enamel, and then it's when you start to get caries. So what happens with the chalky white patch that shows us other on the gums, like I said, at the gum line, in between the teeth, especially where you chew, and then as you continue to eat, it becomes discolored. Because it attracts and holds the color of the food that you eat. So if you drink a lot of coffee a lot, or red wine, or any staining food, then it attracts that color and then starts to become darker and darker and darker. But also at the same time, the enamel is still getting weak, because now it's being demineralized, and then you develop caries or you develop a cavity. And then as it goes towards, it becomes darker, and then it becomes brittle, and then it breaks. The enamel breaks, and then you have a hole. That's when you see a hole on the tooth. So it's basically that. So to prevent that, you really need to floss your teeth, to clean in between. You need to brush on the gum line as well. I've done the video on the flossing and also the brushing technique, the proper way to do it, so that you know how to do it. Because some people, they think that they're brushing, but they don't. They think they're brushing correctly. I know everybody's brushing their teeth, but the correct technique is what that matters, because it removes the maximum bacteria in the mouth, and then it prevents caries. So make sure you brush your teeth properly and also floss properly as well. The best way to prevent caries is just eat a healthy diet, more in fruits, veggies, and dairy as well. Like your milk, it gives you calcium as well. So yeah, guys, it's simple. It's simple as that. Floss, brush properly. I'm repeating myself, but it's just an emphasis. Visit your dentist every 6 months to see, because dentists are able to identify the early signs of dental caries. So it is really important that you visit your dentist for a checkup every 6 months, and a clean. Then it's easier after cleaning to see the demineralized enamel with the sticky fissures when the caries is starting to develop. That is why it's important when you use when you brush your teeth, you have to use a fluoridated toothpaste, a toothpaste with fluoride, so that it can remineralize your enamel again, to strengthen it again, and then it doesn't become it doesn't continue to be in a cavity. So brush, floss, brush, and use a fluoridated toothbrush to introduce fluoride in your teeth, so the enamel can stay stronger for longer. Thank you for watching. Make sure you subscribe. Leave a comment down below. Click the notification button. See you on the next videos, guys.